Welcome to the deep dive. Today we're zeroing in on joint pain, which, it touches so many of us.
It really does.
We get bombarded with ads, advice, but what actually works? What's just, noise?
Yeah.
Think about this. After back trouble, joint pain is the #2 reason people end up going to the doctor.
Well, it's incredibly common.
So we want to cut through some of that confusion today.
Exactly. We're diving deep into a really informative video. It features Sergey Bobnovsky.
Okay.
And our goal is to get a clear picture of what he, as an expert, sees as effective and maybe more importantly, ineffective when it comes to actually looking after our joints.
Right. And we're not just taking his word for it. We're looking at the why behind his views.
Precisely. The logic.
And we're basing this on excerpts from the transcript of that YouTube video. So straight from the source.
That's right.
Okay, let's jump in. First big one. Supplements. You see them everywhere. People, even younger people, taking pills, powders, all promising to heal joints, restore cartilage.
Big market for that.
What's the expert's take here? Does this common practice actually hold water?
Well, Bobnovsky is very clear on this. He says the idea that these supplements can actually repair your joints, it's a fundamental misunderstanding.
A misunderstanding. Why? What's the the core issue?
The key thing really is anatomy. Cartilage, the padding in our joints, it doesn't have its own blood supply.
Right.
No blood vessels.
Ah, okay.
So anything you swallow, any supplement, any pill, it just can't directly reach the cartilage to fix it. Not in your knee, not in your hip.
But you see these supplements, they have impressive names, ingredients that sound related to joints, like chondroitin, glucosamine.
Right.
Do those specific ingredients make a difference when you swallow them?
Well, even if they contain those things, remember how they get around your body. They go into your bloodstream.
Okay.
And your blood circulates everywhere. It's not targeted. It doesn't just go to your dodgy knee and ignore your perfectly good shoulder.
Right, you can't pick and choose.
Exactly. Bobnovsky uses this analogy like it's hard to imagine a pill deciding, okay, I'm going to the right knee today, not the left. The blood just takes it system-wide.
So what's his, overall assessment of supplements then? Are they just a waste of money? Or could they maybe do something?
He doesn't generally frame them as, dangerous or harmful per se.
Oh, okay.
But he definitely sees them as largely useless for the intended purpose of repairing cartilage. And yes, expensive.
And maybe distracting.
That's a big part of it. He worries they give people a false sense of, oh, I'm doing something, which might stop them from seeking out treatments that actually work, like exercise.
Like putting a Band-Aid on a flat tire.
Sort of, yeah. Or his analogy was trying to fill a leaky tire with air from a balloon. Looks like action, but doesn't fix the leak.
Gotcha. So the bottom line on supplements for joint health, according to Bobnovsky.
His strong advice: save your money. Don't bother with the supplements. Focus instead on what he calls kinesiotherapy.
Kinesiotherapy, which is basically treatment through movement.
Exactly. Targeted exercise. We'll get more into that.
Okay, that's pretty definitive on supplements. Let's move to the next thing. Injections. Directly into the joint.
Yes.
You hear about plasma injections, hyaluronic acid, sometimes hormones. Is this helpful? Is it the solution some people think it is?
Well, on this, Bobnovsky is even more forceful, actually.
Oh.
He considers injecting stuff into joints to be potentially a very harmful practice.
Harmful. Wow. Why is such a strong stance? What's the anatomical reasoning there?
Use a really good analogy again. Think of each joint being inside a sort of sealed bag, a capsule. It's hermetically sealed, like a car tire.
Okay, like a tire holding air.
Right.
Makes sense.
So when you stick a needle in there for an injection, you're puncturing that seal. You're damaging the capsule's integrity.
And that's bad because
it can let the synovial fluid leak out. That's the joint's natural lubricant. It's vital. And what's more, he explains, this leaked fluid can act like an antigen, like a foreign substance, triggering an immune response from the body that can actually, over time, contribute to more destruction of the joint capsule.
Huh. So puncturing it isn't just a temporary hole. It can cause longer-term issues. That tire analogy really clarifies it.
It does, yeah. Makes you think twice about those injections.
So injections are a definite no from this expert. Okay, let's talk surgery then. Joint replacement, endoprosthetics? What about the idea that, as soon as you get diagnosed with arthrosis, boom, you should get the joint replaced immediately? Is that the best path?
Here, Bobnovsky's view is a bit more nuanced. He absolutely acknowledges that joint replacement surgery is often necessary.
Right, for severe cases.
Exactly. When a joint is really worn out, deformed, it needs replacing. And he notes it's generally performed well, technically speaking.
Oh, there's a but.
Yes, the but is the preparation. He strongly emphasizes that preparing your body before the surgery is absolutely critical for a good outcome afterwards.
Preparation. What kind of prep are we talking about? Not just mental prep, I assume.
No, physical prep. He stresses the importance of the muscles and ligaments around the joint.
Ah, the supporting structure.
Precisely. A healthy joint isn't just bone and cartilage. It relies heavily on strong muscles, flexible ligaments, and that synovial fluid for nutrition, movement, stability, elasticity, the whole package.
Okay. And what happens if someone goes into surgery, gets the new joint, but hasn't done that preparation, if the muscles and ligaments are weak?
Well, the problem is the surgery replaces the bone and cartilage. Right. But it doesn't magically fix weak muscles or stiff ligaments.
They don't just snap back into shape afterwards.
Exactly. They won't suddenly become strong and coordinated just because there's a new artificial joint in there. It's like putting a brand new engine in a car that still has flat tires and a rusty frame.
Yeah.
It won't perform optimally.
So even if the operation itself goes perfectly, the person might not get back their full function?
That's his point. The new joint might let you walk, maybe without pain, which is great, but achieving a full range of motion, like really bending, running, playing sports, doing active hobbies, that depends hugely on the condition of those supporting muscles.
He mentioned something about muscle memory, didn't he?
Yes, that's a fascinating concept he brings up. The muscles need to be trained before the surgery. They need to sort of remember how to work properly, how to support that joint effectively.
Why is that pre-training so important for memory?
Because the surgery itself involves, well, cutting. Nerves get severed. That disrupts the communication pathway between the brain and the muscles around that joint.
Right, the neuromuscular connection.
Exactly. So if you don't have that pre-existing muscle memory built up through targeted exercise before the operation, your body struggles to figure out how to use the new joint efficiently afterwards.
That makes a lot of sense. So preoperative rehab, doing specific exercises before surgery is really key then.
Absolutely essential in his view. But he's also critical. He notes that not all surgeons really emphasize this enough.
Why not?
Their focus tends to be, understandably perhaps, on the technical success of the operation itself, getting the implant in correctly. The rehab part, especially the pre-op part, might not get the attention it deserves.
But what kind of difference does this pre-op work actually make? Can you see it in the recovery?
Oh, definitely. Based on his own experience using kinesiotherapy with patients, he says those who do proper pre-op training can recover much faster.
How much faster?
Sometimes within weeks, he claims. And they might even avoid needing crutches altogether or for a much shorter time.
Wow.
He really stresses that the real goal of joint replacement shouldn't just be, okay, the pain is gone, I don't limp anymore. It should be about regaining full mobility afterwards. And that hinges on having healthy, strong muscles and ligaments ready to work with the new joint.
So what does he actually recommend? How much preparation are we talking about?
He suggests a dedicated program, at least 36 sessions, he says, which usually takes about 3 months of consistent work before the surgery.
3 months. Okay, and what happens if you skip that?
Well, besides slower recovery, he warns it can lead to persistent issues, like still having a limp, even with the new joint. And quite surprisingly, sometimes people retain the memory of the pain, even though the original source of the pain is gone.
The memory of pain. That's strange.
It is, but it highlights how interconnected the body and mind are, and how important that preparation phase is.
Definitely food for thought if surgery is being considered. Okay, let's shift gears slightly. What about general joint treatment and maybe more importantly, prevention for people not yet at the stage of severe damage needing surgery?
Right. His first point here is diagnosis. But not just an X-ray showing arthrosis. He emphasizes a functional assessment.
Functional assessment, meaning?
Meaning before you treat any joint, knee, hip, ankle, whatever, you need to understand what it can do right now. What are its current capabilities, its limitations? How well does it bend, extend, rotate?
Okay, understand its current state, then what?
Then, the treatment should focus on developing that existing capacity. You work on improving its range of motion, bending, straightening, and restoring muscle strength around it, all based on where it is now. It's about building on what you've got, carefully.
And for prevention, to stop joints getting bad in the first place.
Yeah, the best approach, right. He's a huge advocate for regular exercise. That's the cornerstone, he says, for maintaining healthy joints and preventing degeneration.
And the specifics.
He recommends, as a minimum, performing at least 4 specific exercises for each major joint, regularly. to keep them healthy and working well.
4 exercises per joint. That sounds manageable. You mentioned earlier that surgeons sometimes overlook things.
Yes, related to movement. He points out that surgeons, often focused on the mechanics of the repair, might not always fully address all 3 planes of joint movement in their rehab recommendations.
3 planes.
Yeah, flexion extension, like bending and straightening. Abduction adduction, moving limbs away from or towards the body's midline. And rotation. He stresses that exercises need to cover all these movements for truly healthy joints.
Okay, so if someone wants more tailored guidance on this, maybe specific exercises for their situation, where should they go?
Well, for a really comprehensive understanding and personalized plan, he strongly recommends a consultation at a certified Bobrovsky center.
And what happens there?
They perform what he calls myofascial diagnostics. It's a detailed check of the muscles, fascia, that connective tissue, ligaments, tendons. Based on that assessment, they determine if kinesiotherapy alone is suitable or if surgery is needed, and importantly, the best timing and recovery plan, including that pre-op work if necessary.
Okay. But what if you can't get to one of those centers? Are there other resources?
Yes, absolutely. He's written quite a few books. Many focus on specific joints: the knee, the foot, hip, shoulder, elbow, wrist. They detail his treatment methods. You can find them in libraries, bookstores, online.
Good to know. And he had one final point about replacement surgery, too, a cautionary note.
Yes, just a reminder that, even the best artificial joint is never going to be exactly the same as your original healthy one. It's a replacement, not a perfect biological replica.
Right. Perspective.
And interestingly, he also mentioned that in his view, treating individual joint problems is often relatively straightforward compared to tackling complex issues of the spine.
So summing up his overall message for people dealing with joint issues or wanting to avoid them?
I think the main takeaway is be proactive.
Yeah.
Be patient. Seriously consider natural, movement-based approaches like kinesiotherapy first. Don't rush into things like injections or even surgery without understanding the full picture, especially the role of exercise, because those other approaches often won't work well long-term without it anyway.
And be informed about where to get proper guidance.
Exactly. He mentioned the Institute of Rehabilitation and Kinesiotherapy website for finding legitimate center addresses.
This has been really enlightening. A great deep dive into these common ideas about joint treatment, thanks to Bobrovsky's insights from that video.
Yeah, some clear takeaways.
Definitely. Just to quickly recap, supplements, probably not helping cartilage repair directly. Injections, potentially harmful according to this expert. Joint replacement needs careful pre-op exercise preparation for the best results.
And underlying all of it, proactive exercise and proper functional diagnosis are key for both treatment and prevention.
Right. Having this perspective really empowers you, the listener, to make better decisions about your own joint health journey.
Absolutely. It gives you things to think about, questions to ask.
So here's a final thought to leave you with. Given this strong emphasis on movement, on kinesiotherapy, what small, consistent changes could you maybe start incorporating into your routine starting today to actively support your joints, regardless of where you're at now?
Doesn't have to be huge changes initially.
Maybe it's worth exploring kinesiotherapy further or checking out some of those resources mentioned. Something to consider. Thanks for joining us for this deep dive.